infant of diabetic mother. This is a very short topic in neonatology, and the main thing in infant of diabetic mother, we need to be aware of the complications of the infant of diabetic mother and how to address them. So first thing that you need to remember, that overt diabetes mellitus causes more problems than gestational diabetes mellitus. So we have two different entities. One is overt diabetes mellitus, also known as pre-gestational diabetes mellitus, and another thing is the gestational diabetes mellitus or the IDM. So all the teratogenic problems are, or all the complications are more common or causes more morbidity in case of pre-gestational diabetes mellitus. So congenital anomalies are more common in pre-gestational diabetes mellitus. Than gestational diabetes mellitus. Okay, so we have something called the Pedersen's hypothesis for this Pedersen's hypothesis for in the pathophysiology of regarding infant of diabetic mother. So let us see that. What happens is that maternal hyperglycemia, mother is having diabetes mellitus, right? So maternal increased blood glucose level results in fetal hyperglycemia, and that stimulates fetal pancreas that is the islets of Langerhans, the tail portion of islets of Langerhans, and that result in fetal hyperinsulinemia. So fetal hyperinsulinemia is the cause of hypoglycemia in the baby post delivery. So whenever a mother is getting more and more blood glucose, having blood glucose because of diabetes mellitus, it crosses the placenta, causes fetal hyperglycemia. That in turn stimulates the islets of Langerhans of the pancreas of the fetus, and that results in fetal hyperinsulinemia, and that results in fetal hypoglycemia. Okay, so fetal hyperinsulinemia can lead to fetal acidosis, stillbirths, and even abortion. So mainly I told you in infant of diabetic mother, we will be concentrating upon the complications of infant of diabetic mother. So there will be surfactant deficiency, and that can result in respiratory distress syndrome, delayed fluid clearance, and that is why there can result in transient tachypnea of newborn. So if an infant of diabetic mother is having respiratory distress, most commonly it can be because of TTN, but it can be because of respiratory distress syndrome. In this babies, there is increased metabolism, and that results in a imbalance in the supply and the demand. So there is a relative hypoxia. And because of this relative hypoxia, there is increase in the EPO synthesis. And whenever there is increase in erythropoietin synthesis, it results in polycythemia. So extramedullary hematopoiesis will have polycythemia, and that results in neonatal jaundice, and it can, because of the hyperviscosity, it can result in renal vascular thrombosis and even stroke. So can an IDM baby have a stroke? Just to remember the pathophysiology, then you can answer the questions. You do not have to mug up. Just remember that there is a problem in the supply and the demand. Usually these babies are, because of increased metabolism, they are usually macrosomic